I will tell you now, the removal of hair business is a $4 billion business. That's big bucks. When you think that the whole sunscreen market is 300 or 400 million, and you have an enterprise all over the states promising the removal of hair, unwanted hair, and that business is $4 billion, which has grown explosively in the last few years, we're talking about a very serious enterprise. And part of my remit today is to try to give you some perspective. How much of this is hype? How much is believable? What's credible? What's happening? What are doctors doing? Dentists are doing laser. Ophthalmologists are doing lasers. Optometrists are doing lasers. Maxillofacial people are doing lasers. Plastic surgeons, of course. Dermatologists, osteopaths. Everybody is in the laser business. And I have to tell you, you may judge it to be a cynical estimate. Why is this happening? Why is this avalanche of interest in lasers? And the reason is it's very profitable. One could argue if it was very effective and profitable, that's a perfectly legitimate combination. And I'm going to discuss the fact that it's mainly profitable and not very effective. And therein lies the story. My experience has been this, as I have watched the laser mania develop. And I'm saying when there are 16 new lasers in a few years, I want to call that mania. Well, boy, when I started to read this, I thought, great. Let me tell you how this knowledge develops. When the first lasers hit the market, the results were not, and to this day, are not given generally in peer-reviewed articles with comparative analyses and substantiation claims. They are given at these seminars, and what was said was permanent epilation. One pass, painless, what the hell? It's quite true, You ever saw one of these things? You can do the whole back in 10 minutes, not bad. Well, next year, the same guys come forward in one of these contrived symposia. Well, there's a certain amount of hairs grow back. Next year, you got to do it again. And I'll tell you in the third year, they might need 3 treatments. And I'll tell you that most of the people talking about lasers now are saying, well, it may take 5 or 6 at $1,500 to $2,000 a crack over a 2-year period if you do this every 4 to 5 months to get a permanent epilation. So what I'm saying is that most of this kind of thing, the laser game, is based upon gimmickry. The science is lagging behind the marketing. The merchandising is way ahead of the technology. And I'm still waiting for one good study to come, one, comparing the ruby laser to the erbidium laser, just as Lucy and I did on opposite sides, and show what happens. We now know that you need a 2 or 3 year follow-up period. So if most of the original presentations at these symposia was a guy that bought a laser, and three months later he's giving a talk. Fantastic results. Well, I've told you, of course, that with a tweezer you get fantastic results 3 months or even 6 months. So that doesn't count. I think I wouldn't have, if I wanted to get in the laser business, I wouldn't have the faintest idea how you do this. How do you do it? There's 16 of them. And every one of them, if they come to your office, has some special gimmick. And I don't know where we're going to go with all this. There's no question in my mind, I won't send anybody for lasers, no matter how much money they want. There is no proof yet that lasers are anything. They have an effect. They reduce the number of hairs that regrow. But I would say that most of them on the first pass are certainly not better than 20% of the viable hairs. I developed an interest in electrolysis perhaps 30 years ago because of the poor performance of the people who called themselves electrolysts. And at that time, and I don't know that it's very much better now, there were no regulations, no supervision. If you wanted to do electrolysis, you bought a machine, hung out a sign, and you were an electrolysis. Certification was absent. Some states had some rules, other states had no rules. And I can tell you in Philadelphia, the electrologists who did the most business were incompetent and ineffective. So much so that I would say up until about 15 years ago, most dermatologists felt that electrolysis was futile. You know, the hell with it, it doesn't work. They stopped sending patients to so-called electrologists. In Great Britain, electrolysis has such a poor reputation that the Public Health Service will not pay for the procedure. It is simply considered ineffective. And then I began to see a number of women with real scarring, women that had been in electrolysis and had gone from one electrologist to another over a period of 20 years, ending up with scars. Of course, they didn't have any hair, but they also had a deformation of the skin. Electrolysis is more than 100 years old. It's an ancient procedure. It was started by ophthalmologists, I think about 1875, and then a few years later by a dermatologist. So at that time, that was really electrolysis, based upon the dissociation of water into sodium hydroxide. It was galvanic current, and sodium hydroxide was generated. Sodium hydroxide is lye, as you all know. So lye caused the chemical destruction of the follicle. But later, most electrologists don't use galvanic current. They use high-frequency current, which generates heat, and it's the heat that kills the follicle. And the procedure that Lucy uses and many other electrologists use is properly called thermolysis, killing by heat. In that regard, lasers have a common feature. Lasers also depend upon the presence of chromophores, materials in the skin which absorb the laser energy and convert it into heat, and laser epilation is also a form of thermolysis. We are going to compare thermolysis by lasers and thermolysis by electrolysis, electrology, as Lucy Peters does it. And how about this? This lady has been going to an electrologist for 25 years. Well, she hasn't got much hair left, but look at those scars. And there isn't a damn thing we can do about this except maybe dermabrasion or a chemical peel to help her. That was a very common experience. It was the kind of thing that prompted me to look around and go and listen to people like Lucy to find out, how do you avoid this? I myself had done a study with plucking with a small group of women. If you pluck them every 3 or 4 months, and you do this for years, you eventually get a scar. You can finally kill a follicle because every time you pluck a hair, you cause a certain amount of inflammation, which in turn attacks the hair matrix, and eventually you end up with a scar. But that's not a solution to the problem. What we need is a device which permanently epilates the hair and does not leave a visible scar. Here is the problem with electrolysis. Hairs don't simply go up straight, they just don't do that. They tend, especially in Mediterranean people and in blacks and Oriental, here is the business end of the follicle. That's where the cells are generated that produce the keratin that makes the hair shaft. Let me tell you what the target is. To get a permanent destruction of the hair, you have to destroy this area, which is called the hair matrix, which sits over a papilla, which determines what the hair matrix does. And getting rid of this portion up here, or getting rid of the sebaceous glands, will have no effect whatever, unless you can take a needle and get it down that follicle. So that needle has to be flexible. Otherwise, what usually happens is a non-expert, many electrolysists, will stick that needle in, and it will escape from the follicle, go off into a direction where the matrix is not changed at all. It ends up with a scar, and of course the hair grows back. And that's the issue. What Lucy did was to design, with the help of engineers, a flexible needle, also a needle that didn't have a sharp point. You can imagine if you're trying to thread a needle down here and it has a sharp point, it has a very good chance of penetrating the extrafollicular space, in which case you don't have any effect at all. What Lucy did was to design a needle that not only is flexible, but insulated so that the current doesn't bleed out. And it also has a bulbous tip, not a sharp point, so it can be threaded down through this curve and finally reach the hair matrix. That device, which Lucy called the integrated system, was her contribution to the improvement of electrolysis, and I don't think that anybody has matched that. If there is a match for it, I don't know where it is. Well, maybe this doesn't show so well, but this is a graphic sketch of what Lucy did. Here is conventional electrolysis. It's a rigid needle, it has a sharp point, and when it's put into the follicle, the current, the high-frequency current, bleeds. Most of the current never gets down here. A lot of it is up here, where you don't want it. You don't want any of the superficial portion of the follicle to be scarred, but that's what happens. And when you do conventional electrolysis and you then pull out the hair, it's wet. The external root sheath is still there. When Lucy sticks a needle in, which has a bulbous point and very flexible and insulated, the current is directed to the matrix down below. The upper dermis is spared. So this is a targeted device. The thermal injury is right where you want it, and the upper follicle is spared. And when you pluck out that hair, you can see it's been damaged. You can feel that it's damaged. So these are the contrasts of what conventional electrolysis and Lucy Peters electrolysis, and they're quite different. Pseudofolliculitis, big problem in blacks. Hairs growing back in the skin. I gave it the term and talked about it. We don't have any treatment. Look what Lucy does. You cannot do this with standard electrolysis, and you can't do it with laser. I have seen people who say that they can do it, but the results are not evident and not published. These hairs go like that, back in they provoke an inflammatory reaction, and I think the only person I know who can deal with this formidable problem is Lucy Peters. Here is normal collagen bundles forming a nice fibrous network. Here we have an amorphous glassy mass of destroyed tissue. This is a scar. Notice where the scar is. Here's the surface of the skin. There's still a little bit of a crust up here. All this is useless. The fact that we've made a broad scar and have destroyed the upper part of the follicle is feckless. It's of no use whatever. It's the base of the follicle, which is the business end. If you don't get that, not worth a damn. So this is a byproduct of electrolysis. Next slide, please. And here's what it looks like. The whole damn follicle and the surrounding tissue is a fibrous, amorphous scar. You don't want this. Next slide, please. Here's what happens with Lucy. It's down here where the thermolysis has occurred, where tissue is being destroyed. Up here, nothing has happened. The collagen is normal, and that's exactly what you want. Here's again Lucy. Down here, the papilla has no living cells. This follicle is permanently dead. Next slide, please. And what's nice about this is, since you don't destroy the perifollicular matrix, if you come back 3 months later, which is what we did, this was a follicle that Lucy epilated, and the damn thing has reconstructed itself. That's a perfectly good infundibulum. That's a normal sebaceous gland. You do not see that after conventional electrolysis. I'm talking about electrolysis, which works. I mean, you can get permanent epilation, but you do that with a lot of unnecessary damage to the tissue. Electrolysis works, and even those that don't use Lucy's system certainly can have a permanent effect. I think they're in a different situation. Those devices don't have built-in fail-safe controls. It's hard to get into trouble with Lucy's device. You could get into more trouble with conventional electrolysis. So I'm saying conventional thermolysis is an effective treatment, but if you really want to go to the top drawer, you really want to get treatment in which 95% of the times that follicle is dead forever, you have to use her system. When we compare electrolysis to laser thermolysis, people like me are very unimpressed. I think that what's been accomplished so far is mainly marketing.
Some laser practitioners have convinced patients that the treatment is permanent. This they do based on their own so-called experience and nothing else. No clinically supported proof exists for such claims. I think that the reason that lasers are perceived as a good treatment for hair removal revolves around several misconceptions. Some we've already covered, but certainly it's in my office, with the use of lasers, people often come into the office strictly because they think laser is the answer to their problem. They may not have any other idea about how it works, but they think that it will work immediately, and they think that it will be painless, and they think that it will work perfectly. And I think that's often the draw of lasers. It's a little bit like medicine in general. People just think that the high technology types of procedures are wonderful. They're perfect. They're brand new, and they work like magic. We spend a considerable amount of time explaining, even with the best use of our lasers, that this is going to take some time. There are some possible side effects, and this is even more true for laser hair removal treatments. We know now that we've actually had many patients come to us who have had problems with laser hair removal, with discoloration, ineffectiveness, and even some have complained about the pain and sent them on to Lucy Peters, where they've become very satisfied. There are so many different lasers available today for hair removal. This kind of proliferation we've seen in other areas of laser use as well, not just in the hair removal area. It usually means there's some problems going on, and each company makes an effort to try to correct the problem. An example would be that some of the lasers will have a little note that says they're good for all types of skin. We happen to know that these particular ones often have to use some gooky preparation or some greasy preparation in advance and hope that it gets down into the follicle and it becomes the new laser target. Others say they're only good for certain types of skin, and these will often be just for the lighter skin colors. And what they don't say is that they have to have dark hair in those lighter skin colors. We've found that people would probably need 2 lasers really to treat all patients. This is not a cheap thing to do, and I think that happily the integrated system does treat all skin types without regard to color or hair color. Putting aside the fact that there is no long-term experience or histology to support laser as an effective permanent hair removal methodology, there is no question that it's fast. Treatment of the upper lip would involve 5 or 10-minute treatment sessions. However, lasers have the same weakness as conventional electrolysis, regrowth, which means that the patient must return for subsequent treatments an unknown number of times, which makes it impossible for laser practitioners to calculate the total cost of treatment. We were able to get some pricing models from laser technologists. Estimates are in the range of $300 to $450 for one treatment of the upper lip, with that pricing holding forth for each subsequent treatment. Because of the recognized uncertainty of laser, those using the technology may offer a 1-year package deal with pricing on the order of 3.5 times a single visit, or in our example, between $1,000 and $1,600. This will give the patient as many treatments as desired, but the deal is only good for 1 year. Then the deal is repeated. Of course, treatment by laser of large areas such as legs and male backs runs to thousands of dollars per treatment. I would be remiss if I dismissed the impact of laser on the business. There's no doubt it has caught the public's fancy, but I believe that the lure of laser will lessen as lessons from experience are learned. Laser packs commercial hype, but lacks support in terms of histologically supported long-term clinical trials. Considering all the unknowns relative to laser hair removal, it is, in my opinion, a rather short-sighted business option. As a case in point, I'd like to draw your attention to an article in JAD, February 1999, Methods of Hair Removal, authored by Elise A. Olson, MD, Department of Dermatology, Duke Medical Center. From my point of view, this article, coming from Dr. Olson, who is the Director of Clinical Trials at Duke, clearly points out the serious deficits and lack of any valid proofs of true clinical efficacy with respect to lasers as a permanent method of hair removal. Finally, new and better lasers are coming out monthly, making your current laser obsolete, and they aren't cheap, and their maintenance contracts are expensive. Dr. Kligman's histology clearly demonstrates the dramatic difference between conventional electrolysis and the integrated system. With conventional electrolysis, there is wanton destruction of the upper follicle, surrounding tissue, and very little damage to the germinative area, so little in fact that regrowth and, because of the necessity to retreat the same hairs over and over, scarring are inevitable. Why? Because standard bare wire, uninsulated rigid needles foster inaccurate insertions, and conventional electrolysis epilators aren't as well engineered and do not have desiccating capabilities. In addition, the training of conventional electrolysis technicians is based on inaccurate theory compounded by the use of outdated instrumentation. There is no uniform training among companies and no prescribed disciplines. Conventional electrolysis practitioners are free to practice as they wish with very few restrictions. The result of such treatments vary from operator to operator. The histology relevant to the integrated system shows all damage concentrated at the dermal papilla and surrounding matrix, the true germinative portion of the hair. Sebaceous glands reform. All surrounding tissue has been shielded by the insulation on the probe. The probe's bulbous tip prevents inaccurate insertions, and most important, the integrated system's epilator, which is totally computer-driven and controlled, has been engineered to deliver desiccating current critical to the immediate destruction of each hair. We have been very pleased with the ability to offer electrolysis through the integrated system in our practice. The last few years have seen some real problems with dermatologic care and the difficulty of getting patients in the office with managed care gatekeepers and people having only certain doctors they can see. So that if you're able to offer an extra service to a patient who comes in for another problem, not only is it beneficial to the patient, but it's certainly beneficial to the practice. We want to offer our patients something that we're comfortable works. You can prescribe a variety of things these days that are not necessarily prescriptions, but that are highly advertised or have lots of claims. But I think when patients come to us, they're saying, by the very fact that they're there and that we have MD behind our name, what's the evidence that this really is true and really is valuable? And so that's what drove us to the integrated system in the first place. It was the very first method of electrolysis that was actually in our journals, in respected journals, and still is. It's the only one that I've seen that's been mentioned in any way. The lasers are mentioned in our journals too, but not in a very complimentary way for the most part. We are looking for something that we can offer our patients that will permanently remove hair in the most efficient manner. And I think there isn't anything else other than the integrated system that can do that. Two of the disciplines of the integrated system involve, first, the elimination of the futile treatment of transitional and dormant stage hair, which, by their anatomical location and physiologic condition, are untreatable in those stages. And secondly, basing the format of treatments coincidental with one complete cycle of the hair in the treatment site. We accomplish both by first having patients shave the treatment site 5 to 7 days before treatment. That gives us an indication of active hairs, since only those active hairs are treatable, and they will have lengthened to a point just above the skin surface by the time the patient arrives for treatment. We are able to map out a full treatment schedule for our patients and accurately quote the overall cost of treatment, the overall length of time the patient will be in treatment, and the number of treatments the patient will undergo, since we know fairly accurately from research the complete hair cycle for all areas to be treated. When we add that we are able to warrant our quotes, we put together a very compelling package for the patient. All of this is possible because with the integrated system there is no regrowth. The end result is immediate, permanent hair removal. The patient is hair-free. Of course, this does not take into account new growth stimulated by a hormonal problem, but this is still not regrowth of a treated hair. Because of the total unpredictability of conventional electrolysis, practitioners are unable to advise patients of the cost commitment. With the integrated system, we simply multiply our hourly rate by the quoted hours. As an example, a fair estimate of removing hair on the upper lip would be in the area of $800, $1,200, depending on the quantity of hair involved. The job is done once, and it's done right. I think we were maybe a little ahead of our time in that in the 80s when we decided to take the leap, so to speak, into something that was medically related but was really sort of outside of traditional dermatology at the time. We had lots of motives. So obviously one of them being making a good business investment of our time and money. And the other was that we really didn't know where our patients could get good treatment in the city because of what we had learned about conventional electrolysis. Over the years, that's turned out to be pretty smart. We're definitely way ahead of the curve. That initiative has actually helped us in many other initiatives because of all the things we learned about the business side of extending our services in such a way. We've been very pleased. We've been pleased in how well it's done financially, as well as from the patient satisfaction side. We've been pleased at how many patients it's brought in from the Lucy Peters Treatment Center, who've actually then come over to our offices because obviously working closely with the technologists there, they will send them over should they have a dermatologic complaint. And we've been pleased with the feedback we get from our own patients who, once again, feel like we've steered them in the right direction. Bottom line, though, it's been a long-term, income-producing, completely outside of managed care project that we would certainly do again if we had to start it over. Nowadays, we obviously have a new kid on the block, and that is laser hair removal. It's a little more difficult, I think, for dermatologists to make the decision, but I think if they will read and listen closely to what's being said, they'll realize that lasers just don't cause permanent hair removal. So even now, if I were looking and questioning, what am I going to bring into my office for permanent hair removal, I would still pick the integrated system. There's proof behind it. There's more proof even today than there was back in the day that I was looking in 1984. And there's proof enough to me that lasers don't do it.